you're seated or standing, you want to try to, even if you don't traditionally feel the bottom of your feet, there is sensation at the bottom of your feet. It's just not what maybe it was or what another person has, but that's different anyway because we all have different.
I'm Mindy Eisenberg, and I am a yoga therapist or a yoga instructor who teaches yoga therapy. The yoga therapist word is being used lightly or is not necessarily recognized yet as a formal profession. We specialize in people who have physical disabilities. Primarily my students have MS, but people come in, they could have fibromyalgia, they could have some type of arthritis. I definitely work with people with spinal cord injuries. Sometimes people come in and they have an injury and they feel more comfortable in my class because it moves slowly because of all the assistance available. So we take a whole comprehensive view. So we look at how somebody stands posturally. Even though they might be having knee pain, we look to see what kind of shoes they wear, where's the weight in their foot, do they roll in, do they roll out. We're looking at everything from the bottom
up. If you stay
up.
right here and your belly's up and you don't bend your elbows, you're doing a lot. You may not be ready yet to come down, and that's okay. Build your strength right here.
My name's Erica Colston. I'm 34 years old, and I have a C6, C7 spinal cord injury from a car accident in 2001. I own Walk the Line to SCI Recovery, a spinal cord injury recovery facility with my husband Ira Colston and my parents Fred and Rita Nader. We spend a lot more time focusing on breath and sort of where the energy and the movements are coming from. And that allows me to find new ways to find those movements because I don't have sensation, full sensation basically from here down. So my trainer will tell her what we've been working on and what they want to achieve in that hour with her. And then she figures out how to use yoga and what she knows how to do to get me there.
There are many powerful benefits of yoga that we don't fully understand, and we certainly don't understand the pathophysiology or the biochemical processes that are happening, but there have been a significant number of studies to document the benefits of yoga therapy for our patients. So there was a study on 41 patients in 2006 that looked at blood pressure, that looked at heart rate, that looked at body mass index, and showed that there was a significant reduction in all of these.
My name is Margot Rubens, and I have MS. And my favorite thing to do is come to my yoga class because I walk in one person and I walk out another. It makes me feel better, and it gives me energy, and I feel just better when I'm done here. I think I started yoga about 5 years ago. And I'm here because Mindy, she's a great teacher, and nothing is expected of me that I can't do. And can't isn't a word that we use in class. You try and do what you can do, and it's enough.
Nice. Really nice. Beautiful.
What I need about yoga is to take it all back a notch and learn how to do that. That's why it's important to me. So for me to go,
we still get plenty of workout.
Yeah, we do, but I just can't go and know it's another
it's another hour and a half of
cardio. Yeah, another cardio kind of workout. That I don't need.
The ability to go someplace else is really it's amazing. It's amazing. Mm-hmm. You know, be it when you have the MRI and CAT scans, and just
to be quiet in the machine.
In the machine and not be like, oh God, I can't wait.
This is over.
I know.
Counting the beeps, counting the, you know.
Yeah. But it's receiving, you know, really bad news. You have breast cancer, and dealing with that and going to place and knowing that you're going to do the best you can and one step at a time, and
there's something on the other side of this.
There's something on the other side, and I practice all the principles that I learned in here.
I've seen in my own yoga class, I've seen people who have come in barely able to walk, and after several months of yoga, they're able to walk. And it doesn't necessarily, it's not a cure. It's that the muscles have gotten stronger and the muscles have become less spastic, and so they're able to walk. It's not that they're cured of their MS. It's just that the muscles are kind of retaught how to do their job.
Well, I'm 57 now. I guess I'll tell you my age. And just the stretching of the muscles, I don't know what it is. And plus, what Cheryl does, the energy healing, I'm sure that has something to do with it. And but I always feel better when I come out. I'm usually wheeled in and I'm walking out.
Traditional methods for spinal cord injury are just not, they are just very closed in and boxed in. And I found that with any kind of alternative therapy, alternative methodology, there's more room for things to happen that aren't expected. That's really what it comes down to, is do people allow you the room to play and see if something can be beneficial or not. And I've found, and I don't know this with all of yoga or all yoga therapists, but I found with Mindy that she's very open to seeing where yoga can take me. And that allows me to experience it to the fullest that I can.
It's okay for physicians and the general public to be skeptical. I don't mind skepticism, but if you keep your blinders up and you never take them down and say that everything has to be randomized and placebo-controlled, you'll never buy into anything. There are at least 20 very powerful studies to show that prayer works to help in healing. And there are randomized studies to show this, but most doctors scoff at things that don't include a knife or a pill, and I think times are changing because they have to change, and that's why here in Henry Ford Health System, for example, we are embracing that concept of trying to offer integrative medicine.
In an idealistic way, you would have a physician that would say, you'd really benefit from yoga therapy. They would have the knowledge to know why their patient would benefit from yoga therapy, and then they would refer it. And in a really ideal world, it would be reimbursed. So we wouldn't necessarily have to fundraise to pay for these classes.
Well, there was a woman who, you heard this gasp, and she said she hadn't felt her toes in 5 years. And just one day was something we were doing, and Mindy was was manipulating her and doing some massage, and that's happened more than one time. It's really, it's quite amazing.
Enjoying this conscious relaxation.
This time of absorption.
Where the more you meditate, the longer you meditate, and you just rid your mind of everything else, and you just meditate. Usually there's a mantra that you meditate on, and eventually you just think of nothing. And it's like going to sleep, being a really deep sleep, and you just wake up and feel right. That's what gives you energy, and you can go on from